My name is Dr. John Kim. I'm with the National HIV Labs, which is part of the National Microbiology Lab, which is part of the Public Health Agency of Canada. Dry blood spot testing is a relatively new method for testing. However, it's been with us for about 20 years. So essentially what it is, it's a novel way of collecting blood without having to use venipuncture. And what venipuncture is everybody's familiar with the use of a needle and a tube. So one of the advantages of dry blood spot testing is that you do not need to have a nurse or somebody trained in taking blood with a needle. It's essentially just picking the end of your finger and then dropping it onto a special piece of paper, which is known as the dry blood spot card. It has its origins in the 1960s with newborn screening of pediatrics. It's only been within the last maybe 15-20 years where the use of dry blood spot card collection for infectious diseases, with HIV being the poster child, for lack of a better word, being the main infectious disease in which dry blood spot testing is starting to gain prominence. One of the advantages I can say within the interventions in which we've used dry blood spot testing for diagnosis is that the individuals, we've heard anecdotally that the reason it's been more acceptable is because you do not get the test result right away as you would in the case of rapid testing. It also has other advantages, and as I said earlier, is because quite often these remote communities don't have persons who are able to take blood, via the needle. So as the reference lab for PHAC, we have used dry blood spot collection, card testing, and collection for all of its epi-surveillance studies. So this is looking at HIV and hepatitis C in indigenous populations, men having sex with men, injection drug users, and persons from endemic countries. We've used it for the past 15, 17 years, and to date we've tested thousands, if not tens of thousands. Recently, however, we have used dry blood spot card collection and testing in applying it to diagnostic testing within First Nations communities. The reason it hasn't been broadly implemented is, in fact, dry blood spot card collecting and testing it's mainly been a research tool. So we have to perform validation on it. So it's not like an HIV test that you would use for serology detection or viral load monitoring, where typically companies will actually validate that test, have it approved by Medical Devices Bureau of Health Canada. So it's been mainly a research tool. It's just that we've now taken it out of the realm of research into diagnostics. But as long as one shows proper validation, I can't see why it can't be used in a diagnostic capacity. So it's the beginning of a good thing, and we hope at some point in the future that companies who perform and sell these diagnostic tests, whether it be for serology or for molecular, will now have protocols for dry blood spot testing. We know it's a step in the right direction. We've had good response. We've already shown good efficacy in the two First Nation communities in which it's been rolled out. We hope and suspect that as others start to learn of this technique and some of the advantages associated with dry blood spot testing versus the standard way of testing, which is either the needle or rapid testing, that it will start to become part of the routine way of testing for blood, in addition to the venipuncture, the needle method, as well as rapid testing.